Hello, my name is Charukawata, and I'm going to talk about inequality and HIV/AIDS, addressing disparities in Black communities in the United States as I submitted abstract on January 3rd. So here is the table contents. In the first, I'm going to talk about what is HIV/AIDS for just in case there is a person who doesn't have a knowledge for the HIV/AIDS and programs and evidences, what is happening in the United States, relations between specific community, which is Black communities, and AIDS and proposal solutions, take-home messages. So to begin, I will briefly explain HIV/AIDS. HIV/AIDS is a virus that infects helper T lymphocytes, which cause CD4 cells, and macrophages that control human immune function. And AIDS is a disease diagnosed when a person develops any of the 23 typical complications defined in the list of diseases that can develop as a result of a loss of resistance. In the simple terms, HIV is a virus and AIDS is the name of the diseases. HIV is primarily transmitted through blood, sexual contact, and from mother to children during childbirth or breastfeeding. While new infections continue to rise in some regions, such as Eastern Europe and Central Asia, globally, the number of new infections is decreasing. However, there is still no cure for HIV, which is one of the reasons why these diseases remain a global public health concern, including in the United States. As I mentioned in the title, introduction and abstract, research from the CDC and edited by KFF shows that although Black people make up only 12% of the United States population, they account of 39% of HIV diagnosed and 43% of HIV-related deaths. Recent data shows a decline in new HIV diagnosed among Black individuals, especially women, and a leaving of a new diagnosis among Black gay bisexual men. Recently, Hulu released a film called Unexpected, which focuses on Black women and their experience with HIV/AIDS. I think this has helped raise awareness of this issue, contributing to a partial reduction in current increased incident rates. I also found some Japanese article which specifically comment about Black communities and HIV. So not only so I think the problem is becoming worldwide knowledge, general knowledge too. And in this for based on these programs, the government are trying to do a lot of things. Government and communities are trying to solve the problems, and proposals will be addressing structural racism and social determinants of health, improving health prevention and treatment, community engagement and empowerment, healthcare provider education and training, policy and funding. However, I think these are kind of general challenges. So I found another challenges and issues that makes a problem, so I'm going to talk about it. The core issue, however, is a distrust of a healthcare system. Research shows that distrust of healthcare systems rooted in structural and systematic racism still exists. Structural racism has intensified the experiences of racism and discrimination by operating through various social systems, including policy and healthcare delivery, limiting access to HIV prevention and treatment resources, and turning these experiences into racial trauma. This ongoing issue has harmed Black communities for generations and has led to medical mistrust. According to the research by Kina Cox, many Black adults believe the United States healthcare system is designed to oppose them, and researchers found that the less educated individuals are less trusted trend to have the healthcare system. This distrust is not only due to historical issue, which in the 20th century many Black women were subjected to eugenetic laws that subject them to forced sterilization. In 1955, Henrietta Lacks Lacks cells were harvested and studied without her consent. So what should we do? One effective way to address this problem is to increasing the number of Black healthcare providers. I learned why the not only Geneseo but also another study education system has specific scholarships specifically for Black communities, and I think this will be a big advantage from my experiences. And also, healthcare providers acknowledge disparities and take action is more important. I took Dr. Burke's majors class, sociology class last semester, and she always emphasized that medical education is often riddled with biases, and I think that is true through this, not only her classes, but through these classes too. So taking action, even though it's small steps, is a way to solve these problems. Thank you for listening.